The topic of this discussion will be diseases of the gallbladder, namely cholelithiasis, cholecystitis, and choledocholithiasis. This would be reported by yours truly, Arnaiz and Mr. Vergara Mark Lester. So, let's start the ball rolling by discussing cholelithiasis, cholecystitis, and choledocholithiasis. What do the three of these have in common? These three are diseases of the gallbladder that are attributed to gallstones. You heard me right. That is what their common denominator is, gallstones. So if you ask me what are gallstones, I will tell you that they usually form in the gallbladder from solid constituents of bile. They vary greatly in size, shape, and composition. There are two major types of gallstones. Now, the first one is composed predominantly of pigment. They form when unconjugated pigments in the bile precipitate to form stones. So when you say precipitate, it means they clump together. They are typically brown pigment stones, but they also come in black. The other type of gallstones are composed primarily of cholesterol. So they form when cholesterol in the bile precipitate to form stones. And again, precipitate means they clump together and then they form stones. They harden and form stones. The hows and why of gallstone formation will be discussed in the pathophysiology. But right now we're discussing cholesterol gallstones, so they are typically yellow to green in color. So let's dive into headfirst into the topic. First topic is cholelithiasis. Now, as you can see in this illustration, this is the liver and this is the gallbladder. To simplify it, I have included a breakdown of the name cholelithiasis. So chole means bile, lith means stone, iasis is a condition. So therefore, it is the formation of gallstones in the gallbladder that are most often composed of cholesterol. As you can see here, the stars, they are the symbols of stones. They are symbolic of stones right now. They are all in the gallbladder. There is no inflammation or infection that is going on. They are just present in the gallbladder. There is just formation of gallstones within the gallbladder. That is what cholelithiasis is. Now, onto the next disease is cholecystitis. As if you can see, it's the liver is still there and the gallbladder is now red, and the star, the gallstone, is lodged somewhere in the cystic duct. The breakdown of the name is cholecystitis. Chole means bile again, plus cyst means bladder, and itis is inflammation. So cholecystitis is the inflammation of the gallbladder, usually associated with stones in the cystic or common bile duct. As you can see, I underlined stones in the cystic or common bile duct because cholecystitis, really, what is the most important attribute of this disease is that there is inflammation. Now, the stone can be lodged in the cystic duct, but the stone can also be lodged in the common bile duct. As long as there is inflammation, it is characterized as cholecystitis. And then the next is choledocholithiasis. Now, choledocholithiasis refers to gallstones within the common bile duct. This is the common bile duct. As you can see, the star, therefore representing the stone, the gallstone, is present in the common bile duct. In the breakdown of its name, chole means bile, doco means duct, lith means stone, iasis is a condition. So now that the gallstone is lodged in the common bile duct, this can go both ways. There can also be cholecystitis when you have choledocholithiasis. But in this illustration, there is no inflammation, but it can be possible. Now, I told you before how that we will be discussing the hows and whys of the gallstone formation. Now, we will dive headfirst into the pathophysiology. So the risk factors for these diseases are all uniform. And in order to remember it easily, it comes with a mnemonic, the 6 F's. You have to be female, fertile, 40 plus, meaning advanced in age, family, because there is heredofamilial instances that this could be passed on genetically, especially if you're Hispanic and white. Fat, if you are obese, and pharmacology. The 6 F's used to include fair, the F fair, but since that is included in family, since it's Hispanic and white, in new journal articles, this last F is considered as pharmacology. Now, what triggers our body to form gallstones? Gallstones? What happens in our body so that we form these gallstones? First, there is increased biliary cholesterol or decreased bile acids, and there should also be gallbladder stasis. Now, when I mention these three, it's important to note that increased biliary cholesterol could be the only thing that leads to the formation of Cholelithiasis gallstones, but it could also be a combination of these two or a combination of these three. Now, so if there is increased biliary cholesterol plus decreased bile acids plus gallbladder stasis means that your gallbladder is not performing as it usually should. This is always almost attributed to age. What happens is that bile and other components precipitates. I told you before that precipitates means that they clump together. So these components and bile, they clump together and they harden, and then they form the gallstones, which is in medical terms cholelithiasis. Now, in cholelithiasis, it is important to note that the patient will experience pain, but the distinct characteristic of this pain is that it's colicky. What do you mean by colicky? It comes and it goes, it wanes and it waxes, because the pain is attributed to the movement of the gallstones within the gallbladder. So if the gallstones are not interrupted, then there is lesser pain. So another symptom that can be observed is there is nausea and bloating that accompanies attacks of severe right upper quadrant or epigastric pain after eating fatty foods. So why specifically after eating fatty foods? Know that when we intake food that is high in fat, it stimulates the gallbladder to release bile to the small intestine to emulsify the fat for easier absorption. Now, when there are stones in the gallbladder, it impedes this function, therefore causing this epigastric pain. So now there are gallstones in the gallbladder. What happens next? What if the gallstones travels and blocks the cystic duct? As I've shown in the past slide, this is the cystic duct, and this is the common bile duct. Now, what happens if it blocks the cystic duct? This is the disease called cholecystitis. Now, I've told you before that cholecystitis needs to have inflammation in order to be diagnosed as this disease. So let's dive into that mechanism of inflammation now. Cholecystitis. First, there has to be mechanical and chemical irritation of the gallbladder mucosa. Now, this irritation will lead to irritation of the visceral peritoneum, and it stimulates four gut autonomic nerves, the T5 and the T8. This will manifest as dull, diffuse abdominal pain and may be felt more in the right upper quadrant, and then may radiate to the back and right shoulder. So, remember, there is inflammation in cholecystitis. What, how, and why is there inflammation? Because there is ischemia gallbladder necrosis, inflammation, and loss of gallbladder structural integrity. Now, these will trigger our body's response and it releases cytokine. Now, what does cytokine do to our body? It makes us manifest fever, tachycardia, and it also uh, makes the body produce increased WBC, and it can be manifested as leukocytosis. Now, in ischemia, gallbladder necrosis, inflammation, loss of gallbladder structural integrity, you will observe that there is increased gallbladder lumen pressure and decreased blood flow to the gallbladder. Now, this is connected to each other because bacterial invasion and transmural inflammation of the gallbladder happens, and this is a cause effect, vice versa process, because this self-perpetuates infection. Now, when there is increased gallbladder lumen pressure and decreased blood flow to the gallbladder, there is irritation of the parietal peritoneum that stimulates the somatic nerves. Now, what does this manifest as? It manifests as persistent. It's not colicky anymore, it's persistent right upper quadrant pain, and the patient will manifest abdominal guarding and peritoneal signs, and also, this is very important, a positive Murphy's sign. So, my partner will discuss how to elicit a positive Murphy's sign. Now, what are the complications of cholecystitis? Because there is irritation and there is bacterial invasion, the gallbladder will produce this gangrenous fluid and will have gangrene, and it may also have perforations because of this mechanical and chemical irritation. Now, let's move to another scenario. What if the gallstone travels to the common bile duct? Now, this becomes choledocholithiasis. What happens in choledocholithiasis, you may ask? There is blockage in the flow of bile from the liver and gallbladder. So the bile just is there's this blockage that impedes it from flowing into the colon. Now, this manifests as right upper quadrant pain, and if there is decreased drainage of bile, there is also decreased fat emulsification because bile is responsible for supporting fat emulsification in our body. Now, what does this manifest as? It manifests as steatorrhea and clay-colored stool. Now, when there is blockage in the flow of bile, there is also decreased drainage of bilirubin. Now, what is bilirubin? This is very important because it manifests as obstructive jaundice because bilirubin is the one that gives this yellowish color. Now, the mucosa, the skin, even the sclera of the eyes may become yellow due to this decreased drainage of bilirubin. And this is called as obstructive jaundice, and there may be elevated serum bilirubin and dark colored urine.